What are dopamine cells?
Dopamine cells are involved in a lot of different functions. They're obviously involved in movement, hence their involvement in Parkinson's disease. They're also involved in learning and memory, and because of that, you often find that Parkinson's patients not only have movement disorders, but also have memory disorders. They're also involved in our mood, and again, you will find that Parkinson's disease patients sometimes suffer from severe depression, and they're also involved in psychosis or schizophrenia type symptoms. So again, Parkinson's patients quite often suffer from psychotic episodes. The final thing that they're involved in is in reward. So they're helpful in making you understand what is good and what is bad in the world. And that again can affect your mood.
And my final question, what do you think are the advantages or disadvantages of using temporary cures such as L-DOPA?
So L-DOPA is a symptomatic treatment. What L-DOPA actually is it's the precursor to dopamine. So the dopamine cells take up L-DOPA into their terminals. They use that L-DOPA in an enzymatic reaction to produce dopamine, and that is the chemical which they then release to send their signal to the next cell in the circuit. The problem with Parkinson's disease and levodopa treatment is that the dopamine cells are continuing to die right the way throughout your lifetime and throughout the disease. So there comes a point when there aren't enough dopamine cells left to convert the L-DOPA into dopamine and rescue the movement disorder that you're seeing. So ultimately, as the disease progresses, the effectiveness of L-DOPA becomes less and less. And therefore, it's necessary now to move on to a new treatment strategy and develop medicines which actually prevent dopamine cells from dying. If we can do that, we can either slow the rate of progression of the disease, which will enable people to live their life to their normal age of death, or we'll be able to halt the disease, in which case the patient will be able to actually continue for the rest of their life without seeing any increase in impairment of their performance. The final way in which people are looking to treat the disease is to actually replace the lost dopamine cells by injecting stem cells which can convert themselves into dopamine cells. So you have this replacement therapy, in which case you may be able to actually reverse the disease and make the person totally normal again.
Okay, thank you.